Hi, my name is Michael Pierce,
I'm Seth Jolly.
and we are doing our video report on OCD. Obsessive compulsive disorder, commonly known and referred to as OCD, is a very misunderstood cognitive disorder where one has an obsession, which can be anything such as commonly cleanliness or contamination fears, and it can be almost to the extent of things that are scrupulous or perfection, to just anything in the world that can be considered an obsession. You can obsess about literally anything. The compulsion is where you act to make your obsession feel better. Let's say if you get your hands dirty and you have a cleanliness fear, well, washing your hands may be a compulsion. And this can get in the way of many people's lives. It can interfere, causing people not wanting to leave their homes. It can cause people to be hospitalized. More than 2% of the population has OCD, but OCD is a very largely overdiagnosed disease. Many people that have it truly do not have it as bad as others, and many people with OCD have to go for help, and it is treated by the gold standard of medicines, SSRIs, selective serotonin receptor inhibitors. And what these do, these work in your brain and cause an increase in serotonin. Serotonin is a chemical in your brain which causes euphoric, or not euphoria, but causes you to feel better. Flooded serotonin levels cause extreme happiness, and drugs and alcohol cause overflooding of serotonin. That's why people get so happy on these things. SSRIs can help up to 30% as a maximum when it comes to OCD, but the other 70%, the top 70% is something called exposure response therapy. Exposure response therapy is a branch of cognitive behavior therapy, and cognitive behavior therapy is the behavior of our mind and how the mind works and the actions. But under that, cognitive behavior therapy is a very large umbrella, and under that umbrella is a sector of exposure response therapy. And exposure response therapy is basically, in a nutshell, facing your fears. You see, every time someone has an obsession and their fear comes true, let's say, I think germs are going to harm me. Well, my obsession is germs harming me. So if I get germs on my hand, or what I think is, I immediately wash my hands. Well, when I have that obsession, my anxiety's up here, and then it drops. But if I wait it out, it takes a little longer, but over the course of time, it will come down. All anxiety has to come down. It may take 10 minutes, it may take 10 hours. 10 hours, very extreme, but it can take up to hours. And the basis of exposure response therapy is you force yourself in that uncomfortable situation where you touch what makes you uncomfortable, or you do the opposite of what your obsession tells you to do, and you resist your compulsion. So if you're afraid of doorknobs, you touch a doorknob and you don't wash your hands, and your anxiety may be spiked at a 10 out of 10. Over time it comes down, and then the next time you do it, it's an 8 out of 10. It comes down until it's easy cake, and then the next thing you may amp it up. Touch the doorknob, touch your face, touch the doorknob, eat, to the point of where you're touching your shoe, touching to where you do extremes and you go over. And these principles are implemented in many hospitals, such as Rogers Behavior Therapy in Wisconsin, and also in Nashville, Tennessee. There are also hospitals in South Florida that work with the University of South Florida, and UCLA also has a very intensive OCD program. An onset of OCD can start when the strep virus enters somebody. We're going to edit that. OCD can be suddenly onset by strep throat, and we see this mainly in children going through puberty, anywhere from their age around 10 years old to 13, 14. And what happens is your brain, when your body's fighting off, sending these antibodies to fight off the strep virus, it actually sends the wrong messages to your brain, And these things go through your blood-brain barrier and they attack your brain, and you can actually look at a picture of a brain and it is completely different than an OCD brain and non-OCD brain. And this causes obsessive thoughts, it's very intrusive, it causes kids to lose their temper, have anger, and odd tics. And Seth is going to demonstrate some of these tics. So some are kind of seem like Tourette's, such as tongue thrusting, or jumping up and down, or even counting. And this frustration leads to very bad anger, where kids have seen, there's videos, and there's even a 60 Minutes where kids are tearing down their Christmas tree, or punching holes in the wall. It causes extreme anger, and if not treated right, kids can be put in jail. And that's why it is so important for them to get the right therapy they need and right treatment, because without this treatment, these kids will suffer with this disease for the rest of their life. OCD is a curable and treatable disease. Thank you.